doctor.
South Africa's private sector rates for C-sections is 70%, where the government sector is around 20%, and that is really concerning. The reason we're concerned is that research shows that a cesarean without medical indication is 10 times more dangerous than normal vaginal delivery. So the power to decide is rightly or wrongly in your hands. Moms, and all too often, you're not equipped with all the information you need to make an informed decision, which is exactly why I've asked Meg Faure to join us on the show today, the best-selling author and OT with a special interest in babies, to talk to us about our options. Meg, you've had both. I've had none. So tell us about your experiences on both Caesar and natural.
Yeah, my first two babies were natural deliveries, and it was just awesome. I was on such a high afterwards. There was a lot of pain. I'm not going to tell any mum that there was no pain, because I did it without any pain relief.
Wow.
I tried the gas and threw the mask away because it was just too much to coordinate.
Well, do we applaud that or not? I mean, it's almost worth applauding.
I don't know. But I think the reason I could do it like that was because I'd had really amazing antenatal classes. So I knew what was coming, and I knew at what point the pain would finish, because I knew when the contraction was finishing. So I think when you're very well equipped with good antenatal classes, your ability to have a natural vaginal delivery without pain relief is significantly higher. With my third baby, everyone said, oh, she'll just slip out. You know, you've done this before, you've experienced, and was completely different, because Emily had her own mind, and she was just not coming out, and for a number of reasons probably, but I'd been in labour for a very long time. My waters had broken more than 24 hours before.
Sure.
And my gynae said, it's now time. There's a risk of infection. I'm not leaving you for another, because that was now 6 o'clock in the evening. She said, I'm not leaving you overnight. We need to Cesar. And it was a very, very different experience. But I think the biggest reason why I really didn't enjoy my Cesar as much was because of my recovery afterwards. I was on high, painkillers, because being an emergency cesarean, you do have more pain afterwards, whereas a planned cesarean slightly less. And so I was on pain relief, and I'd wake up at 2 in the morning when she was crying for feed and think, I've just done this, or how long has she been crying? And I felt very distanced from her because of the numbing of the pain.
Yeah, almost the fog of the pain medication.
Completely. And then also my other little ones who were not able to just climb on me and be loved by me, and couldn't access me in the way that they could if I'd had a natural. So for me, the entire experience of a Cesar was really second rate to a natural delivery, which is why, although I really do understand the need for Caesarian sections, it does baffle me when mums do it electively and actually choose it.
My wife has exactly the same experience. You know that. Natural and then Caesar, and also preferred natural. So we'd love to go natural, but we understand at certain points we do need to have a Caesar. When we have a Caesar, what are the negative effects on baby? I mean, that's your speciality, is how baby experiences these things.
Yeah, I mean, I like to look at everything through the baby's eyes. So I start right from in utero, and we know that the interuterine world is absolutely perfect on a sensory level for babies. So it's warm, it's containing, and towards the end it's very tight, and that tightness is actually something that's very important. Now they come out into the real world, whether they're born by Caesarian section or by natural delivery, and it's a complete assault on the sensory levels. So I like to say, okay, let's have a look at what goes on in utero, and how can we really make this transition into the world as smooth as possible. And really, vaginal deliveries do that for babies. What happens is that there's a huge amount of squeezing and squashing as the baby comes down through the birth canal. There's a little bit of a release. There is. And there's a bit of a release of stress hormones, which everyone goes, stress hormones not good for babies. But actually, those stress hormones are very, very important, because what those stress hormones do is they move the baby into what we call the calm alert state. So babies born by normal vaginal deliveries are much calmer for the first 3 or 4 hours after birth, and very alert. So what happens is that they really make eye contact with their mums, and they connect in a way that Caesarean section babies really don't. And the reason is that after Caesarean section, the baby has had less stress hormones, and so they're not as alert, and so they don't engage as readily with their parents. So for me, that's really, really important.
And maybe it's worth mentioning at this point that there are certain indications for a Caesarean section. So if you take a look at the screens over there, if any baby is in an unfavourable position, head up as opposed to down, that's an indication for a Caesar. A maternal condition that may be made worse by the stress of labour, such as heart disease, another indication. A placenta that's blocking the cervix, we call that placenta previa. Multiple pregnancies, an exceptionally large baby like Lisa's, 4.2, a previous baby, and infection with HIV, which can be passed to the fetus during vaginal delivery. Those are indications for Caesar. You need to have a Caesar done. Meg, we're talking about a natural Caesar. Now, that just is complete Greek to me. What is that?
Yeah, I mean, I think that it's very important to know, and you've mentioned those factors, that if you need to have a Caesar, Caesars are life-saving. And so if you made the decision, or your doctors have made the decision that you need to have a Caesarian section, you go for it and you feel good about it. Now, if you've done that and you're going for it, there are some things that you can do to actually make it as natural as possible, and that's what a natural Caesar is. So the first thing would be to preferably go into labour spontaneously. So you would be allowed to do that if there was not a massive threat to you or the baby. A placenta previa, for instance, they probably wouldn't let you go into labour spontaneously because there's a risk of the placenta coming first. So under certain circumstances, you can say to your gynae, could I please go into labour naturally? Because then you know that your baby is actually activating the labour and saying, I'm ready. So that's the first thing, because babies actually activate labour, not the mums. So go into labour naturally if you can. Secondly, really write yourself a birth plan about what you want to happen immediately after your baby's born. And that is that if your baby is healthy, so in other words, they've got APGARs that come up very quickly of like anything above 7 and then 9, let's say, that your baby can be given to you and placed on your chest immediately. Traditionally with Caesarean sections, they take the baby away from you, they put under lights to be warmed up. And in actual fact, what we know about mums' bodies is that they're the best incubators that there are. Right. So say that they'll have the green sheet so that you can't see yourself being cut, thank you very much. But above the green sheet, if you can be naked with maybe a towel over you, your baby gets passed to you immediately, put on your chest, naked itself, and actually gets monitored there. Forget about the weighing, forget about all the other stuff. If your baby pinks up nicely, they'll let you keep your baby on your chest. You really want to take what you could do with a natural delivery and make it applicable to a Caesarean section. And it is possible, and I think it's a more gentle way to go into a Caesar.
Meg, thanks for those insights. And it's true what Meg said. You want to aim for natural, but if you can't, and Caesar's the way to go, accept that, go for it, and make the very most of it. Really, there's only one question you should be asking, and what's the safest option for my baby and for me in my specific situation? And only your gynae or doctor is able to accurately answer that.
I want to live the best life.